Hello, everyone. We're pleased to be joined today by Israeli Dr. Itai Pessach, a pediatrician who is the director of the Children's Hospital at Sheba Medical Center. Now, Israel is leading the world in vaccinations against COVID. Is one of the first countries in the corresponding list. It has been administering the fourth dose already, and there are officials who are even saying the country could reach herd immunity. So Dr. Pessach, we're of course under the impression that your country is one step ahead in the pandemic, and we'll have the chance to get your insights on what are the next steps. Thank you for being with us.
Thank you. I'm ready for any question you might have.
Sure. Let me start with your specialization, which is pediatrics. Our children in Greece went back to school through intensive testing. I know this is something Israel has also undergone. Are you in favor of children getting back to school in the midst of the Omicron wave? And how severe is it for children to be infected if they're vaccinated as opposed to being unvaccinated?
Okay, I think that's a key and important question. I want to start with the first part. I think that having children at school after these very complex 2 years that the whole humanity has underwent is critical. And I think what we see after 2 years of being in this is that the damage to children from this pandemic is not just the direct medical problems, it's more the psychological impacts. And we do see a significant rise in the psychological illness around the world in children. And the fact that they have stability and that they go to school is really, really important in maintaining their mental health and their general health for the future. So I think any effort that could be undertaken should be taken in order to let the kids go to school and maintain some normality within this very intense times. Having said that, we do see some difference in the pattern of illness in pediatric patients and children, especially in the countries where the Omicron wave has struck earlier, in the US, in the UK. We did see a significant rise in children being hospitalized. Nevertheless, it's very important to notice the fact that even though the number of children that were hospitalized is increasing, the death toll in children and the complex illness in children has not risen. And even in Omicron, the most of the children that are infected either go through the illness asymptomatic or do not develop severe sickness. And therefore, in the balance between the going to school and maintaining a normal life and on the other hand, the medical illness, I think that trying to keep the kids on track is the better idea, and in parallel, preparing the medical system to confront this illness when the kids go or when the number of children arriving to the hospitals do rise. And this is what we've done in Israel. We had a few weeks to prepare because of the policy of the government here that allowed a slight delay in the Omicron arriving into Israel. That allowed us in the pediatric world and in the general hospitals to be more prepared, to prepare the emergency departments, to prepare the hospitals. And we don't see a significant challenge currently. I don't know what's going to happen here within the next 2 weeks, although I don't think we will reach capacity and we will still be able to provide very good pediatric care.
But is testing the answer to get children to school? And when we're talking testing, how do antibodies tests differ from the diagnostic tests? Right. I know you implemented the antibodies testing, I believe, when children would return to school in September last year.
So that is actually, again, a very important question, but the answer is a little bit complex. So the ability to test all children that come to school is a right way to go if you are dealing with a certain amount of children getting infected. So as long as you can control the infection and delay the surge, testing every child when they go to school, or maintaining children at school even after they were exposed to a positive child, or a positive friend or a family member, is a reasonable way to go. We have done that during the September coming back to school from the summer vacation here, and it worked very well, and we actually didn't see a rise or a surge that resulted from opening the schools, and I'm very happy for that. Definitely for vaccinated children or children that are recovered, that have recovered from COVID, there's no issue. They are protected, and I'm not sure they need to be tested. However, there comes a time, and I think Israel is currently at that point, where the number of positive children is increasing by magnitudes, that starting to test every child every day is going to be not really helpful in preventing the spread of the infection. We did see that most kids are actually infected at home or after school, and not during school time, because when they are at school, and if the school maintains the right hygiene protocols, trying to keep most of the activity outside, maintaining masks throughout the lessons, keeping the groups and not mixing the groups, then the children actually are not infected or almost not infected in the school, even when the disease is actually very active. They get infected at home, they get infected in the afternoon when they play with their friends in close quarters without the masks. And so it's very hard to prevent the spread of the infection once you cross a certain border or a certain number of positive children that you have in the community. So currently at the rate, and we have over 100,000 new cases a day in Israel today. That's the estimation. The formal number is about 40,000, but we expect the real number to be 3 times that. So when you have that large number of infected persons, and about 30% of those are children, you're gonna be very lucky if you can prevent positive kids from getting to school. So again, until you get to that point, heavy testing is really important. When you get to that point, the protocol should go forward into hygiene on the one side, and the other side is teaching the parents or trusting the parents to keep positive children at home, to keep symptomatic children at home. The same goes to the staff of the school. If the child has a slight fever, slight cough, even a runny nose, they should stay at home. And that way, that will in some way limit the amount of spread. And again, I'm going back to what I started with. The real solution is to vaccinate. If the child is vaccinated, their chances of getting hospitalized are very low. Their chances of developing the complications of COVID are almost non-existent, and that's the way to go. We expect here in Israel that within the next 2 to 3 weeks, more than half of the population would be infected with Omicron. We're gonna pass the number of between 2 to 4 million positive cases within the next, out of the 10 million more or less population that we have here. And if you add that to whomever were already infected, you're going to get to almost half the population that has met Omicron and actually underwent it either symptomatic or asymptomatic. At these numbers, you're not going to be able to limit the spread. You can decide to close the schools, but that's not going to limit the number of children that are getting infected.
Half of the population. This is what the WHO also indicated a few days back about the general population all over the world. Now, initial data from your hospital, Sheba Hospital, show a 5-fold increase in antibodies for people who have taken the 4th dose, doctor. Is it safe to say that this 4th dose is clearly effective? Or will it take time to scientifically be sure about this? And people are asking, you know, we first had these 2 doses, then you doctors told us we need the 3rd one. Now Israel and other countries, of course, will be have initiated the 4th one. Are we going to be constantly getting shots just to lower chances of being hospitalized? And will this not lower the effectiveness of any new shot we take?
Right. So again, going back to the vaccination, you have to take that into context. The context is the amount of people that are infected around you. If you have a surge, if you have a new variant, and you compare that to your, let's say, routine. So the number of doses is not something that, for myself as a pediatrician, as an immunologist, and as someone that has dealt with this pandemic for a long time now, the actual number of boosters, I don't think is a relevant thing. The question is the relevance of the booster. If I'm giving the booster to the right population, is it going to be effective in protecting them against the next wave? So we, for example, recommend vaccinating to the influenza virus every year. We do give 4 doses of certain of the pediatric regular vaccines during the first year of life. So the number of boosters itself is not the key. The key is, will I get any protection from that? And what we have seen initially now, and it's very early to call, we did see that the new booster, or the 4th booster, creates or elevates the level of protective antibodies after even a week after getting the booster. If that is going to protect us from severe illness or for infection is kind of early to tell. The only thing we can tell at this point is that the reaction that we are seeing is very similar to what we've seen for the 3rd dose. When we did the studies on the 3rd booster, or the 2nd booster, the 3rd dose, and actually we saw a very good effect of the 3rd dose in limiting the previous wave, the 3rd wave. Here, it actually more or less saved our population from getting into a huge surge and actually saved a lot of lives. So I am optimistic that this is going to help. However, since we're not at the point where we have the data, we only recommend the 1st dose currently to people that are over 60 or to people that are in very significant risk groups of getting severe illness from COVID. Again, because we don't have all the data. And the rationale around that, as I said, is the ability to take the level of risk that you have to the level of the risk of getting infection, because we are at the middle of a surge now, and to the knowledge about what's the benefit that you're going to have. So as to your last question, I don't know what's going to be the next surge and where, when, and if it's going to come. I am sure that if we see that this comes again in a few months, in 6 months or 8 months, and we'll see the protection of the current booster or of recovering patients going down as we've seen, we will recommend a next dose. Hopefully, it's going to be a more directed or tailored vaccine, which is different from the one that we're giving now, and it's going to be more protective against the next variant. However, unfortunately, with Corona, we see that the COVID virus mutates too fast for us, and the surge comes before we are able to tailor the vaccine. But I'm sure that the companies that are working on that, the research that's done in that area, will bring to a point that in a year time from now, more or less, as we do with the influenza, we change the vaccine to influenza every year to be protective against the specific strains of that year. I think we're heading to that direction. Then once or twice a year, we will need to get an updated booster. Probably not all of us, probably just those that are at higher risk of developing severe illness. And again, I'm not going to be surprised if everything I say now is going to be different, because this pandemic has not stopped changing and evolving and surprising us.
Yes, finally, I want to say, Dr. Pessach, I first read about you a couple of years ago when you treated Syrian refugees in Israel, people who had survived bombings on the other side of the border in Syria. Your hospital was allegedly at full occupancy, but you said there are no borders, correct me if I'm wrong, no borders in medicine, and you treated these people. This is so remarkable, and of course you're doing your job, and this is the right thing to do, but how tough is it to be human in this world of constant conflict?
So I think it's the other way around. you cannot be inhuman in this world of conflict, because when you're in an area of conflict, and I think the whole, as I said, the whole world, the whole humanity now is under the same, more or less, stress or strain because of this pandemic. And we see how important the fact that we need to care about each other, and we need to not just look at ourselves personally or our community, but look wider and look around the world and see where we can actually affect and help. So if I look at my peers around the world, the medical teams around the world, I think this is our greatest hour. And you see how it's not just in a Chiba Medical Center in Israel, but it's around the world. We, despite the fact that we are under extensive stress because of this pandemic, as all the medical teams, we have not stopped lending our hand and opening our hearts to whomever is in need, no matter if he's from Israel or from the countries around us or from other places around the world. We actually do care for patients from Cyprus many times, and we'll continue to do that and do whatever we can in order to help. I think this is the time for these borders to a little bit, I know we cannot solve that, but we can maybe through this, through medicine, through the places where there is no conflict, because there is no conflict about the life of children. There is no conflict around the need to help a person in need. So we need to unite around that. And I think everybody around the world knows that this pandemic is not going to go away until we find a solution around the world. It's not just giving the 4th booster in Israel or the 3rd dose in the UK or wherever in Europe. It's about vaccinating the whole world, lending our hand in peace and in help to anyone in need that is going to solve this pandemic. And I hope, and I'm almost certain that this lesson is going to be learned, maybe not for the long term, but at least with some hope for the near future.
Such a powerful message to pass on to others. A truly nice way to end this quite informative, doctor, interview with you. Dr. Pessach, thank you for being with us today here on CNN Greece.
Thank you, and stay healthy.
Sure, thank you.